I like and welcome one and all to the MSA Crusaders call. Voices strong, spirits bright, join us as we ignite. We're here to share, to inspire, to lift each other higher. With stories of strength, voices that shine, this is our journey, yours and mine. You're tuned into MSA Crusaders, where awareness begins, one story at a time.
Welcome to another episode of MSA Crusaders. Today we have Sarah and Carrie with me here. David's out of town again to Jamaica, and we're going to talk to you today about a few things we got going on.
Okay.
Carrie,
Thank you.
first tell us what you guys have been doing since we had you on the show last.
Well, about the same physically, but my speech is worse. That's been the change. Probably since my UTI in January, everything progressed after that.
You've been getting
I'm still walking, and some days my speech is clear, but it fades in and out. So
you've been getting all UTI.
in January is my last one. It hospitalized me for 4 days because
Wow.
it was drug resistant.
Yeah.
So they IV antibiotic me because I had Pseudomonas something.
Sarah, you have set up residency in the hospital lately, haven't you?
It visited the Baptists and the Methodists and everybody. But I can empathize, Carrie, with the, here's my IV antibiotics that I will be starting today. Levaquin IV.
Yep.
Because I just had 6 days of IV Rocephin, and it is not the right one for this UTI. But this UTI is a continuation of the UTI from the hospital that was undertreated. So we were going based off of that sensitivity report, and it just has gone awful. So, yep, I'm on antibiotics. They just delivered the IV Levaquin. I'll start that tonight and hopefully be better soon. But yes, I have been visiting all the facilities. Do you want to say that I'm sassy? Like I'm just, it's not really like a great thing.
Discriminate.
Yeah, I'm not discriminating. I'm sharing the love, all sides of town, of San Antonio, some of the smaller towns and some sections, just kind of checking out each hospital, ranking them.
Making your way around,
Me too.
Yep.
The mail banner. Yeah, those ones I've been in.
I need to do something I've had one since February. They put me on 90 days of antibiotics.
Make sure they got the right.
Yeah.
Because mine just start in December, and they cleared it up, but they didn't. I went back in to my doctor. He took tests, and it was resistant. So,
yeah, that's the resistance culture. They got me on 90 days of antibiotics, and then after that, they're going to put me on preventative, hopefully.
But did they do a sensitivity report to see if this is resistant?
They did.
Okay,
good.
So, we'll see.
This is
antibiotics our
As we
houses
said.
become hospitals too.
Yeah, the hospital hotels are expensive. Like $5,000 a night. We could go on vacation. Be nice,
Right? Tell us
Well,
about
my
your
insurance company didn't want to just pay for my medicine, and so I ended up going into the hospital. So they got a $500,000 bill and had to pay for my
There you
IVIG.
go.
So, one way or the other, if you don't want to, then
I could do it at home, but you won't let me. It costs more
exactly.
to be there. It's ridiculous.
Yeah.
I'll
So
stick
they
it to
got
you.
all of the bills. Yeah.
Sarah.
Sometimes.
Yes, I was.
Who would thought? I
Yes, Carrie.
like attention, but this is more than I want. I like to stay and not send out.
Ask your child. Tell us about that.
So I go on July 9th. I get to Denver. They're going to assess me for the MASCOT MASCOT 3 trial, and they think it looks pretty good. Like they think, and that research is good. It's those phase 3
Yeah.
MASCOT trial. So
Doctor's all trying to get me on it, but
and that I go to the clinic to get MRI, spinal tap, all that done that day. They got to make sure because your doctor says yes, doctor says that, and then the company has to approve you too.
you screening.
So hopefully all works out well.
They pay for your
Do they do a
hotel.
pre-screening or anything before
They
you
did a
make that
pre-screen.
travels? Okay, yeah, good.
And then I travel. It's quite pricey to travel there. My doctor for the mail in Arizona reached out to yesterday that he's gonna have the same trials. I have lots of questions to ask if I can transfer to here, but they're not ready here and they're ready there, so that's what's hard. So next month would be treatment or whatever. So they're doing threefold. So 1/3 gets a low dosage, 1/3 high dosage, and of course a third placebo.
Now,
So we have nothing gets nothing.
when will you find out if you have the placebo or not? A year from when you start, or
I
a year?
imagine probably you would notice the progression.
Because y'all know Gary, right?
Huh?
Yes.
He did the GD&L test. He still doesn't know if he did the placebo or not.
My
They
dog.
haven't told him. They told him that they'll tell him a year after everybody that has been in it for a year.
Yeah, and after the trial, it's open label to everybody.
Right.
Trial, but you could progress a lot in a year.
We don't know.
Yep.
But no
Yep.
trying gets no trying, right? Nothing gets nothing, you know.
What do you have to lose, right?
Exactly.
So that's hot.
That's my thought too.
Yeah.
We're hoping. I'm sure everybody else in the trial is hoping too. There's only 360 in the trial total worldwide, so it's still
Really?
small. So that means 120, 120, 120 when you break it down. So
Yeah.
we'll see.
I kind of
Wow.
feel like, Dr. Dolph said I was too far progressed to do it here too. So everywhere I've gone, I've heard that, and I've heard that I had syncope before, so I can't do it because of that.
Yes, because it's 5 years and less onset.
And mine's gonna be 6 in November.
Mine was 22, so 3.
Yeah, I'm 6, past 6.
And they won't let you try. You have
But you
to
see-
walk and
IVIG,
fusion and no levodopa. So
IVIG has really benefited for you, Sarah.
they're very
That's
picky.
my own program. That's why I'm like, you know, when I went into the hospital, the day that I went into the hospital this last time in May was because they did not, I had to switch insurances.
Mm-hmm.
And the new insurance wasn't doing the prior authorization quick enough. And so I think I was due for treatment on Monday. I have it every Monday and Tuesday at home. And by Thursday, I had no voice. I was stuck to the bed. I had only 300 cc urine output. I was up to 10. What was I up to? I was like maxed out on oxygen. It was 10 liters is my max that I could go to the concentrator. And it was just, I was like, I started with the ascending paralysis and I was like,
Wow.
so it was so bad that my son was visiting and he's 6'5". He put me in his car and he drove me to the hospital. And, you know, we didn't even call an ambulance. And I usually like have to go by ambulance transport, like to go to a doctor appointment or something. But like the paralysis was happening so fast. And so they gave me IVIG. They're like, we don't do IVIG in the ER. Like pretty soon they came and they brought in the IVIG and they got me started with the stat. Like, because the paralysis sets in and my body was just.
Oh, no.
So.
I'm good.
Yeah.
You got you
I'm
there.
proven.
Carrie and I need some IVIG for our speech.
So IG is treatment.
Immunoglobulin. Well, so it's not necessarily a treatment. There was a study done in 2012, but there were only like 6 people in this study. Today, I attended a webinar from VCU,
Mm-hmm.
and I was late to it, but I got on, and they asked, for me to introduce myself and whatever. And so I said, like, that I was very pleasantly surprised to hear at the Mission MSA International Conference that one of the patient speakers, there was 2 males and 1 female, and the female was on IVIG for another condition, and so she spoke of it there. But she's on it for other autoimmune diseases. It's not something that like would get approved for MSA, but there is, I think it's called like the second consensus from the movement disorders paper. I can't remember the exact title, but on there as there's like a list of treatment options, and IVIG, which is immunoglobulin, IG is immunoglobulin, it's on there as a treatment option in that paper. And that's a published like second consensus statement, I think is what it is. So I brought that up today at the webinar, and the doctor had said that there was, he had a patient that was also on it for another condition, but it's really walking the line, because if you try and get insurance to cover for under the diagnosis G90.3, they're not going to cover it because it's a terminal condition, right?
Right.
So, but I have Guillain-Barré and CIDP, and I have reoccurring Guillain-Barré and CIDP, like a rare variant of Guillain-Barré. So I continue and have had IVIG for 6 years, and there are many doctors that have said that the only reason that I'm still here is because of my ventilator and the IG.
Oh, wow.
So someone like me and
My
Carrie,
sassiness.
someone like me and Carrie, how can we get this IVIG?
Man, you know what I said? I said, how do people like me, who we know this isn't a cure, like IVIG isn't a cure for any of the things. Like, it's just something that you have to keep doing to maintain and to improve quality of
Right.
life.
I'll check in.
For me, it just keeps me, keeps me saying, I still go down. I still have a stoma. I still have a suprapubic catheter. I still am on a ventilator. I'm still on oxygen. Like, it's not a cure. And I never, ever say, like, IVIG is a cure for MSA. What I'm saying is it's a treatment option that I believe should be available to other people with this condition, because it helps so many of the autonomic symptoms.
Hmm.
And that's what we're trying to do. Like,
Right.
bowel, bladder, body,
The 5 Bs.
all the bees, blood, everything. Where a lot of those
Treat
things
the
are
symptoms.
addressed. Yeah. And that's what we're doing. So we fix what we can fix. I had like an
Deal with what I
ablation,
deal with.
loop recorder, blah, 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 but treat the underlying condition, which is neurologic, with an immunoglobulin, and then do all the therapies, all the everything else that we could do. So how can you guys get it? I don't know. The doctor that was saying said, like, maybe my doctor could write like a single case study or, something like that. So I want to talk to her and ask her.
Carrie, do you have neuropathy?
I do. In my feet.
Does it treat neuropathy?
CIDP stands for chronic inflammatory demyelinating polyradiculoneuropathy, or polyneuropathy. I have polyradiculoneuropathy because it's the nerves and the nerve roots.
Yeah.
But neuropathy, if you have neuropathy, I would think that you should be able to be treated with IVIG because it's chronic and it's inflammatory and demyelinating. We're hitting the bases here.
Yes, you are. I'll
Yesterday,
ask my doctor.
my palliative care
Curious.
doctor, he put me on a higher dose of nortriptyline for my neuropathy. I
A
take
higher dose of
nortriptyline.
what?
Nortriptyline?
Yeah. I tried that to do
It didn't work.
anything.
It works for me. I'm on 100 milligrams now, though. You guys are up because it just come back. It burns. It's such like you're burning on the inside out, doesn't it? Do y'all feel like that?
Say again?
Your feet burn from the inside out,
Sometimes, oh,
like they're on fire.
sometimes it feels like I put my foot in a snowbank, and then it gets so bad that like when you take it out and it starts to thaw, that it's like that hot, like
Yeah.
fire.
Like walking on coals.
So
I
Like
get
walking
that.
on coals. Coals. Fire coals.
it's pretty.
Hmm? Yeah, me too.
Yeah. Yeah.
Vice grips on it and like cramps
Yeah.
that just like, and then yeah, then you put your foot in a snowbank and leave it there until it's like
Yeah.
like ready to
Sit
thaw,
there.
and then it's burning, and he's like, "Oh, that's how you feel right now?" And I was like, "No." I'm like, that's how I feel. That's what Ted's unit reminds me of, because like if you try to explain what kind of pain you have, it's just like,
They don't give.
Carrie, tell us about your purple hat.
My purple hat is a beret from Amazon, and I'm gonna wear it and go out, breathe, go out to, for awareness.
It's for awareness. And we're all going to get one, and we're starting a purple hat study.
I think so.
And women can join.
It's
And you wear your
Oh,
hat.
was 10. If you look on Amazon, there's so many.
Yeah. And it's for awareness. And it's an icebreaker. You have it on in public. Someone will say,
Going
what's the
to, I just got it today, so
What's the purple
that's
hat
a
for?
good idea.
So I think it would be like more awareness than what we have for just the, the piece of cake
you need
challenge.
to raise awareness.
We're creating so many songs, and Carrie and I are going to have an album out, so
For
we're
the
going to
work
say
on that.
awareness. Yeah, I'll work on that.
That's so great.
We're going to
I'm so
collaborate. It's
excited.
very good.
Yeah, we'll have some song too, so we'll work together and do
Yeah,
it.
it's been fun, hasn't it?
It helps you express because
Your
you
feelings.
talk
Yes.
like
Very
normal,
good
like
therapy.
you, Sarah. I wish I could talk to you.
Me too.
Sweetie.
It's very therapeutic.
Yeah,
It-
it is. It's
It
therapy.
is something that is, it rises, it falls, it rises, it falls,
And
So there are days where I can't talk, and there are days where today my voice is strong, and so to explain to somebody when somebody says, well, you don't look sick, or
Our
you don't
songs
look
will-
stupid, but here we are.
Our songs still say a lot. I do. They
Like-
say a lot.
At first, advanced degrees, not dumb. And sometimes, like, the songs help all that transfer somewhere else.
Get it out of you.
Yes.
'Cause I
I
used
thought-
to sing and play my guitar, and I can now because of this. So it's an outlet I have.
It would be,
I'm very
but
thankful.
I thought my
What about
therapist says
karaoke?
I tried that.
they can't see.
Yeah.
I lost my singing voice in probably 2018.
Yeah.
I'm trying to find a way to put my voice on pseudo.
I tried that too, but can get it going. I can figure it out.
Yeah. I'm not
That's
giving
so
up.
cool.
I'm not giving up. I want to put my
Oh, you're
singing
not.
on.
You'll figure it out.
Put my voice on there so we can make music with our voice. But in the meantime, it's a way. I told my therapist yesterday about it, and she's listened to a lot of my songs, and she said it's very therapeutic. And it is. I only talk to her once a week, but I can write a song every day, and it's a way to get things out.
It is.
I have about 15 songs now, and a lot of them are about USA.
That's so nice.
So these
It's
are
definitely a way, and You guys have such a way of, like, I just cry because, like, it's like you're taking the words out of my head that I can't put into right.
Together.
You know, like, you guys are able to do that. And my brain just doesn't work like it used to. I used to write poetry. I used to read books all the time. I used all kinds of things. And it's like my brain is very challenging right now to try to do those. So to see and to hear your guys' music and Austin and, you know, all of the, it's just like I
Yeah.
cry because it's like those are my thoughts and you guys are taking my thoughts and you're putting them, and it's such a beautiful way. And yes, it's sad, you know, but it's reality.
It's art.
And
It's raw.
it's, yes, it's our reality, and we are stronger together
Yeah.
and help each other. Like,
Yeah.
know that.
I wake up every morning and I have one song in my head that's in my head.
That you ever wanted to
I wrote two today. I wrote one. I published one for Joy Saunders, and
They-
then I wrote one to myself. It's called Same Old Same Old. Carrie said it's like get up my bed, get in my chair. It's the same old every day.
every day, same thing.
It's sad to say, but this is how it is. It's the
So you
same for
guys
us.
do you do a routine or anything? Like, do you have like a specific routine that you create for yourself, or
Mine's just getting out of bed, getting in my chair, and up for about 2 hours later. Some exercises, stand back up 2 hours later and do some exercise. I didn't get to go swimming today
I,
because
yeah,
my dog wasn't had to go to the vet.
our dogs, aren't they sweet?
Yes, they're like our kids.
Walter,
yeah?
So I had to take my husband had to take my dog to the vet so I could go swimming. Carrie said she knows swimming makes her feel free. And I remember that feeling because I used to be in the pool and I didn't have to have help. But now I have to have help in the pool. I can't stand up by myself. I drown. I fall over frontwards. So I can't
If you
swim.
get into trouble, just lay back and try and float.
I can float, sure. Even when I can't do it by myself anymore, I have to. A therapist to hold me.
yep.
Yeah.
So I don't have freedom feeling anymore.
I can still walk. I'm thankful for that.
You feel free, don't you?
Yeah, but it's slow.
Hey, it's moving.
All right.
We're
There's one, but there's only, you know.
because like I took
Progress, not perfection. Progress, not perfection.
a video walking the other day, doing my therapy, and
Nice.
I miss it.
it does, but it's sad to watch. You're like, what's so simple for others? So here I am, extra. It's hard to the big steps.
Well, and there's like just doing that, people don't know how much really actually goes into that. Like, there's
Right.
so many
It takes-
neuro things
Yeah,
that you have to think about and like plan and then tell your body what to do. Like,
it's hard to.
My therapist was
I
holding
was
me-
amazed. Yeah,
therapist was
that's
holding me-
awesome.
Holding me by my shorts from behind, and he said I walk in the water and swing my arms, and I'd have to walk with my left leg and then swim with my right. But I haven't to think about it. It's not the same.
Hmm?
Step left, swing right. Step right, swing left. You know. Never
Yes.
thought of that. It's like rubbing your stomach and patting your hand.
Oh my
Exactly.
gosh, there's no way. I wouldn't, I'm like,
Can't do that.
it's very challenging. I always ask my therapist to stand next to me, not across from me. Because if they stand across from me and they like use their, you know, like I'm using my right arm, but like they're using their, I can't flip in my head to do what they're doing. So I'm like, can you just stand right next to me? And so I could just like glance over and then copy what they do.
Or they-
Because my brain can't flip and
Right.
say like do the other thing. Or today I was doing low to high with ease, and then high to low to high, and then high to low with E, like E, E,
It's
or
hard.
however. And like I was like, oh my gosh. And I was
Yeah.
like, I mean, those are things where it's just like you have to think about it before you do it. And then
Right.
God forbid, like there be a noise or something, or somebody like touch
Right,
you while
turn
you're
you off.
doing it. It throws you all off, and it's just like,
Okay, start over.
Yeah,
My
like
therapist does that too, and my OT belts me, belt and behind me helping,
yeah.
and neuro teach different in it. And
Is it
neuro,
all has one of those gate belts that go around your waist and that has a handle on it?
I have
Yeah.
one
I want
home
to go
too.
so bad. I don't want to go so bad.
You could get one
The
Amazon
the
for
gate belts, yeah.
Does it
$8.
help?
I think yes.
It does.
Get one.
No.
No.
I have to have knee braces on. If I don't have IVIG in my system, like I'm walking maybe 5 feet. Like
Hmm.
I'm not walking far at all. If I have IVIG, like today, I walked probably 20 feet total in the session. Um, so that was it was a good session.
Yeah.
Yeah.
But I said, I
Lot.
was just paralyzed for a month. Like I spent from mid-March to mid-April, I was
Speaking of that,
paralyzed.
have you heard from Eric? Either one of you? Talk to
No,
Eric.
No.
He hasn't answered me, but I see he posted the other day, but I don't think it was him. I think it was AI.
Haven't heard at all.
I'm really worried about him.
It's hard to
no. Some things that I noticed are that, and this is just a personal observation, I have noticed that the meds seem to progress faster
Right? The
than the
trials?
women. Like, does that seem,
Man. No, that's
you
true.
know,
I think that
it
too.
just because I mean, in like groups, like in Zoom groups, there's one that I go to every third Monday of the month.
But then you look
And
at David. Look at David.
yeah, David, I'm just like the men seem to progress, and up on the Mission MSA when they had that international conference, the patients that were up there were two males and then one female, and the female was on IVIG, and she did not appear as
Progress.
advanced as the two males. But again, you can see me like this one day, and you can see me like another day where I can't move.
Day by day.
It literally, it's treatment dependent too, and you just have
I
to
have
roll
really
with it.
progressed in this last year. I have really progressed. I'm sure y'all noticed that. My speech
Every
is like,
time I have anesthesia too, I progress.
and see, I'm getting my teeth pulled out. And I'm gonna
Don't
be,
do anesthesia, girl.
they're
Don't,
doing,
don't
they're
do
doing,
it. Don't.
I'm not getting all my teeth pulled out any other way. There's no way. I'm like, Carrie, don't take me to this.
Yeah.
I don't know. I just,
Yeah.
I had 2 emergency surgeries in February.
Oh.
So I was under for 3 hours on one of them and 2 hours on the other. And
Well,
then
part of
I had
it,
a planned procedure in March, and I was only under for an hour and a half, and I get out of it, and like I wake up right away, like right away from the anesthesia. And they didn't even use paralytics, but I was paralyzed. And then I was paralyzed for a month. And I was at a long-term acute care center, like blah, 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 hospital. And it was just like a bill. And since that time, since March, I haven't been able to get off the ventilator. And I'm up to between 8 and 10 liters of oxygen.
I'm really worried about, I have trouble speaking now. Am I really going to have to ever speak again after I have my teeth pulled? That's my biggest fear. That's my biggest fear, is that's all, that's going to be talking again.
I can
Yeah.
get that.
It's a valid concern, but you know what I tell myself? I'm like, we've been here before. We've gone through this before. Like, I literally talk to myself. And I'm like, we've done this before. You've lost this before, and you've gained it back. You've lost it. You've gained it back. You've lost, like, so I just tell myself, like, it doesn't mean it's the end. Like,
Yeah.
I have an infection, or I got infections from being in the hospital. Like, that's what I got. Like, pick line
Yeah.
infection twice, DBT, like, from being in the hospital.
Yeah.
I've had my Mediport and I've been fine, taking care of it myself. But
I'm
the
really worried,
hospital
you
set you
guys.
back.
I'm really worried.
I can see
It's a
that.
valid worry. It's a
We'll
valid
take
worry.
into Yes.
But you
I-
gotta do what you gotta do, and if maybe there's different options for sedation.
I got my teeth today.
Yay!
Okay.
I'm
Are you gonna
really,
show us your choppers?
Babe slow.
here's what's hot with just a partial. It's 2 teeth. 3 2.
Nice.
But as far as the bottoms,
I would drop those things in a second. They'd be gone. I'd lose them.
No,
they're
me
the
too.
whole things.
Nice.
The whole thing. So I have a mouthful of teeth, at least. I might not hit top,
That's
but I
so
have a mouthful
nice.
of teeth.
But you know what? Well, you do what makes you happy and what you want to do because it's about you.
Exactly.
I'm so scared, though.
We'll
So
be
scared.
50 somehow, some way.
I'll have to let y'all know when I go.
Yes.
But I don't
Yes.
know
We'll
when it's going to
definitely
be
be
yet.
praying for you, sending all the love, all the light, all the everything.
Everything. Yeah, definitely.
I'll need it.
We all do. Here we are.
Yeah.
We are. And with the Purple Hat Society, I'm going to have to get a purple hat
Yeah,
now.
order one.
Tell us what
Yeah.
else you got coming, Carrie.
A sash that says multiple atrophy.
And the pins, are you getting those?
You get on Amazon.
On
So
Amazon?
She got
you can
pins.
personalize it to you. I put autism atrophy on it.
And so
That is great.
Cause look,
Yeah,
That would make me cry. My gosh.
it's so true though, isn't it?
it is. We talked.
Yes,
about
that's
that.
why. That's why. Some of them just like,
They speak to you, huh?
they just speak to me because
Speak
it's,
for you.
yes, speak for me. I
a
first started losing my voice in 2019. And it's definitely relates with a weakness. If my body's weak or, my voice will be the first thing that will go. And it just goes along with the weakness, like, of the whole body, of my diaphragm. I mean, the vent right now, it's breathing for me completely. 15 breaths per minute. A patient triggered 29%. So it's doing a lot of work for me to allow me to be able to do this, but that's what it's for, and it's about energy conservation and all of
Yeah.
it for all of us,
Yeah.
what do we want to spend our time doing? What is
Right.
most important? Prioritizing.
It's sad that you had to prioritize your energy, isn't it?
Oh
There's
my gosh.
song that. There's song. I'm
There's a
taking
song.
notes.
Yeah.
I see it right
Well,
over there.
it's like, I mean, it just to get up in the morning, like you can't just like
Yes.
get up.
Shit, your
Like-
brain doesn't.
I could start to get up at 5 o'clock and I have to do breathing treatments. And then I have, my bag, my stoma bag. I have my ostomy bag or my suprapubic catheter bag. Like,
Are you on
but
feeding
my
tube now?
hands.
Are you on a feeding
Yeah,
tube?
well, not a feeding tube, but TPN. I don't have any, so I don't have a colon, and I only have part of my small intestines, and I have like no absorption, so I can't do a feeding tube. So I have nutrition that just goes through my veins. Yes.
Oh,
But I could swallow some things like yogurt,
Applesauce?
applesauce.
Other than that, I had
Can't
dreams.
eat regular meals, but I'm never hungry. Like I try so hard, but I'm sniffing alcohol pads and taking Zolfran if I have to eat something. Like it is almost like torture.
huh.
The other night, I tried to get out of bed and I was asleep. I had my left foot off the bed and I had put it almost on the bed. I had to like wake up my husband and say, put my foot on the bed. I couldn't do it.
You know what? So you get the gate belt and get a gate belt and you tie it around, put it on your foot, and you have the handle up so then you can move your foot. They thought I was crazy at the hospital when I'm like, can I please have a gate belt? And they're like, do you need,
Why?
you can't walk. Like, they're looking at me and I'm like, so I can move my own leg. Like, it doesn't move itself. Like, I get the gate belt and then I'm like, okay, if you just
You're going sailing.
put it on my foot, then I could
Move
move my leg.
Yeah.
Yes, that's,
It's like going sailing.
yeah. So gate belts have multi-purpose. I usually
Dude.
have, like at home, I have a leg ladder, but I didn't have it at the hospital. So I was like, how can I improvise?
Yeah, my trapeze, I can't use it and pull myself up. I tried it, but it hurts my shoulder.
I need to find like MSA Mama, her video, like she has
pole?
like the pole. I need that. But my family is like, I don't think that would be sturdy. Like it looks like it, because the ones that I found on Amazon were like tension, and I was like, no, look, MSA Mama has it.
I'll have to ask her where she got hers and stuff.
But I'm like, I need that whole pole.
Yeah.
Because my bed goes up, the feet go up, I have the bed railing, but sometimes it's just not enough. Like,
Yeah, exactly.
She's coming
They
back. Did I say all that?
no, I love watching her family, and she
I
has
can
such
so
a
relate.
great spirit. Oh my gosh, I would love to
Yes.
meet her.
Did you see the part where she's on the porch she toots?
Yeah, that's funny.
I love the one where she was trying to do something by herself, like without her husband, and then she was stuck and she couldn't move
Oh.
over, and so her husband was like recording her saying what, and she's like laughing, and
Yeah.
that's so like my husband and I. Like, I'll just try and get sassy and like do something
Yeah.
myself, and it ends up backfiring. Like,
Me too.
you know, like all the urine is all over the floor instead of
Yep.
in the bag because I tried to do it myself.
Yeah.
And then it's like a bigger mess, or like, you know, just anything. It's like I tried, and then it's like I should have
Nope.
just waited for help.
Right. I like the
But I
video of
just
her
thought
walking
I
in the
could
yard.
do
She's
it
bending
myself.
her knees and she's walking in the yard. And I said, that is so me right there. Hey, did you see the one where she's kicking the ball?
Yes, that's awesome.
Mhm.
That's a
Some good
great,
therapy, isn't it?
Yep,
exactly. That's something. Yes,
it's hard
and
to do.
putting it's very hard. When I stand, I have to stand with like a wide gate,
Me too.
and like my knees have to lock. Otherwise I'll go down. So, and I have knee braces on. But today when I walked for PT, he's like, "Are you going to use these? Do you have another forearm crutch?" And I was like, "I'm just going to push my vent." So he's like, "How'd you think of this?" And I'm like, Molly MacGyver? I don't know.
Work creative.
You use your resources, and it's
Right.
you
You
just
do.
turn the thing around and you could push the ventilator, and
Do your
it's
best.
on wheels, so like
It's her mobile
it
walker.
works.
Is that
Yeah, exactly. Like, I have my walker, I have my power chair, but it's something that's right there, so I use my
Use that.
vent if I can.
Using your
use my
noggin.
dog up and down? My dog helps. I'm like, come here, and I use him to walk again. Walter,
Really?
come here.
Oh,
my
that
dog.
would be nice.
He's perfect size for this is Walter. Everybody,
Oh my gosh.
he's always with me.
Does he have a hat on?
Yep, he does. He does.
Is he part of the Purple Hat Society?
I'm gonna get him one.
Does he have glasses on?
Yeah.
He's a Bernie,
How cute.
so he's knee high. So I'm
Perfect.
down. I can use him. Okay, I see you.
Yeah.
He's
My
always,
Susie's about ankle high.
yeah.
Oh, Stoopy? How's
Yeah.
Stoopy?
He just got up with that. He's doing good now. He has
Good.
allergies in his eyes.
Okay, sit. Well, this
I've
is
been having a lot of allergy stuff, and I have lived in South Texas since 2009,
And-
and I've never had allergies.
The pollen
And
is bad this
ironically,
year.
I've developed them in the middle of my acute respiratory failure stunt of
Wow.
April, and I was just like, why? Like, it's
something else
coincidence
at-
that, like,
yeah, I had that too.
I don't know that it's really allergies.
Me and Carrie were talking about that
But-
earlier. I watched Walker on the porch. It's white and now it's yellow. It's like the fun dip, you know?
Yeah, fun dip.
Oh yeah.
Yeah, that's the fun dip.
It's
Oh
fun.
my gosh.
Well, you
How's your grandbaby?
She's doing good. She's getting so big.
She is.
She
She's 3
is
months old now.
a fun.
She's
Okay.
7 months.
3 months.
Oh,
she
I'm
rusher. Oh, she rusher.
Great.
I was like, I was in the hospital longer than I thought. Holy moly. Okay, 3 months old. Okay.
Don't rush her. She's getting
I've
big
been-
enough.
Watching.
Yeah, Carrie's paying attention.
I'm jealous in a way. I don't have any. Probably won't.
I wrote 2 songs for her.
Yep, it's like I have Daisy to love to.
I can't wait to do her
Yes.
cowgirl pictures, but that's not happen until she's 6 to 9 months old now. The outfit is 6 to 9 months. So
9 months.
She'll grow.
I want to do her cowgirl pictures.
Yeah.
Cute pictures of that. How fun.
Oh, we'll have fun. She's my little Ray.
Yep,
In
great.
a ray of sunshine.
That's right. And she's talking now, and she's taking everything in. If they hold her where she can't see the room, she gets mad. She wants them to turn around so she can see everything that's going on.
Oh, cute.
Well, you too.
That's
It's been
really
really good
nice.
having you both on. Carrie, do you have anything else you want to add?
No, because I have to talk anyway.
I don't know. I'm getting tired and I can't talk.
It's the end of the day, and you guys are doing great. And you are so talented. I love listening to your music.
Thank you.
Thank
And
you.
it really, really does speak for
I can't wait to
all of
collaborate with
us.
Carrie.
Huh?
I can't wait to collaborate with you.
It was fun. I'm
Yeah.
excited.
I am too.
Just
Really?
dedicate the bee song to me. That's all I ask. Just
Yeah,
dedicate that to
that's
me.
what I wrote for you.
It's you. I
Look,
think
look.
about that.
The
I'm like,
bees.
bees. How are they? Go back to the song.
She told
And,
me that. She told me about the
so
bees,
much.
the disease of the bees, so I had to come up with that song for her.
It's
Yes.
a bee too.
It's
Ah.
funny.
Hey, yes, it is. Yes, it is. It is.
Big bee.
But every day is what we make it. And,
It is.
sometimes we have
I have our
better
days.
times than others. And,
Yep.
We have our times.
we roll with it. We roll with it.
That's
Yeah.
all
I
you
love
can
the
do.
Michael
J. Fox.
J. Fox, it can accept the diagnosis, but you don't have to remit. So you can
It
still
got you,
carry
but you don't
on,
have
keep
to have it.
going.
That's true.
Right. Right. Accepting has made it so much easier. I wouldn't say easier, but you know what I mean. It has
Yeah.
made it so that, like, I mean,
It's become a part of me.
we have an advantage. We can really say, like, we're grateful to see the sunrise, the sunset, like
Exactly.
every single day.
It's
We
like-
are mindful of those situations, all of those things. Like,
Catherine's song
there-
I wrote for her is she is a fighter. I'm a fighter, and she doesn't take life for granted anymore. And that's what you have to do. Don't take life for granted.
You don't.
That was this morning. I
Yeah.
lay my head down at night when I go to sleep, and I say thank you for getting me through another day.
yes.
I had a friend tell me, be thankful for days you can hear. You
Yeah.
can always be thankful for that. I'm like, well, it's hard, but yeah, you're right.
Shay,
It could be
Alright,
worse. I mean,
you anything? Say
Say what?
my
you
friend,
want to add anything?
huh?
Say it.
I'm just gonna get a purple hat on Amazon so I can be at the Cool Kids Club.
Yeah, get one. It's like give you a cookie.
Yes.
Yeah.
Yes.
Cool kid.
Yes.
That's
It
us.
was great to see you guys. So great to see you guys.
You too.
Just
Sure,
keep
you
chugging
don't hear-
along. We got
Kinda-
this.
Kind of fitting in the middle.
got it.
Me and Carrie not having a very good voice.
Yeah, sorry.
So, you guys are beautiful.
And
And
thank
I
you for helping
appreciate
me in
everything about
group.
you.
Thank you for helping me in group when I can't speak.
Oh, you're welcome.
Well, I'll have
My pleasure.
my husband help me speak.
And Sarah's my translator.
There's on, I think it was our 20th wedding anniversary, maybe 2 years ago, I couldn't talk. So I was writing things out. And I got a t-shirt that I wore for my husband for our anniversary. And it was something, I think it said something like, "Will you marry me?" or something. But I literally could not talk.
It's hard.
And so that's why it's like, I know how like, I can't say I know how you feel, but I know how I feel when I lose the ability to do something. But I always tell myself, it'll come back. It'll come back. Maybe it comes back differently. Maybe it comes back, like, I wouldn't be able to sit here and talk if I didn't have my vet taught. I wouldn't be here without my vet. So do I look like an elephant? Yes.
A
You
cute
know,
Do you
my
care?
nose is very long,
No.
very big nose, you
Yep.
know, I sound like I have my nose plugged, which,
You
know,
gotta do what you
but
gotta do,
this
right?
is me. This is, you've got
Yeah.
to do what you've got to do and put everything to the side, not worry about that.
Yeah.
Find your purpose and just go for
Find it.
that and keep that in the forefront of your mind. And also just, I think, allow everything that you feel to just
Be
allow
felt.
yourself.
Feel it.
Yeah. Just
Felt. Yeah.
don't stuff it. Don't stuff it. You know, sometimes people may think like, oh my gosh, you're angry or you're. No, I'm passionate. Sometimes I'm angry, but
Just go for
I'm
the face.
passionate. It may come across different, you know? Don't let anybody assume like that your quality of life is, you know, less
but
than or whatever.
feel-
Just because
Or
somebody
less.
doesn't want to have tubes and holes and all that, like it doesn't mean that my quality of life is any different. Like
Yeah,
it
are
just
what
is
we
what
are, right?
I choose to have this to, and there's been a lot of things that have actually improved my quality of life. So I just encourage people to never say never and wait until the situation comes and find ways to adapt. And when you can't, you
find
know,
ways to
you find a way to do
That's
something
also
else.
do.
Do it another way.
a
Yeah.
Toby or
Pretty
ever
useful. We
They-
say
that the MASCOT trial at the mail, they said that some people get skills back with the trial at the MSCC. So I'm hopeful anyway.
we'll say prayers for you.
Yes. Prayers, fingers
Yes.
crossed, positive
Everybody.
vibes, love, light, all the things. And
Definitely.
Send positive vibes.
Yep.
Okay, girls. I love y'all. And
Cheers.
thank you. Remember what? We're all MSA Crusaders.
Yes,
yay. Good night. Thank you.
As we close another chapter, remember you're a factor. In this fight, we're not alone. Together we have grown. With every voice that speaks its truth, we shine a light, we're living proof. Remember, we're all MSA Crusaders, and together we can make a difference.